Okay, I'm gonna tell you a little bit about my externship, my internship, whatever you want to call it. 'Cause I've been out in the hospital. A few things I cannot discuss with you. I cannot tell you any specifics about patients or anything I've dealt with. You know, I can't tell you a few things. I'm also going to try that cigar, and my wife doesn't like cigar smoke, so she wants me to try this smoke freshener granule thing. So I'm gonna do, I'll throw this in the ashtray, blah blah blah. Okay. My computer's screwed up again. I've been up in what at hospital I'm at is called SPD, the Sterile Processing Department. Goes by different names, different hospitals. But anywhere, it's where all the instrumentation and accessories and stuff from the hospital start and end up. So, let's say when I get there, you always do it the day ahead. So like, any surgery done Tuesday, the case carts are prepared Monday. Okay? It smells good though. This stuff. So, just pour a few granules into the ashtray. I don't really use an ashtray, I use this cast iron little pot. So, I'm gonna put a little more in there. So that's how many I got in there. So anyway, what you pull is the actual instrument trays. They have like the knives, retractors, forceps, and stuff like that in there. You'll pull like IV bags, bottles of sodium chloride solution, sterile water, drapes, suction kits, catheter trays, all that stuff. And you got this big metal cart that you put everything in, you close it up, and you got a slip of paper that has the patient's name, the procedure being done, and all the stuff that's supposed to be in there, and you just pull a piece of tape, put it on there, and send it on down to the actual OR department. Then the procedure is done. After everybody, right before they're done the actual procedure, okay? When you're actually done with the procedure, the patient's, stitched up, sewed up, whatever, and they're actually pretty much on their way out of the room. But right before they stitch everything up, they do what's called the final count. Count everything that was used. Anything that went in that patient or went near that patient will be counted, with the exception of things that obviously cannot be in there. Okay? Any towels, sponges, instruments, knives, blades, sutures, all that will be accounted for. They do that for each level that they close. So if they cut into your skin, into your muscle, and we're working on your bone, they will count as soon as they're done doing whatever they're doing. Let's say I broke my arm and putting a plate in there. Once they get that plate good and done, doc says, alright, we're going to close. Count. He stitches up the muscles. Count. Stitches up one layer of skin. Count. Next layer of skin. Count. The next layer of skin. Count. The next layer of skin. Count until they're done. Until their stitches right there, they count their time. So that's all done. So then you just take all the stuff, put it back in that cart, and send it upstairs. Now it goes to a different area, by the way. It's called dirty. It's called the dirty side. You get the clean side and the dirty side. Dirty side, they bring it up, and that's where they scrub off all the blood, all that gooey off of there. Then they run it through like this big dishwasher thing. It doesn't sanitize it, or it doesn't sterilize it or nothing. It just massively cleans everything. In case there's any little bit, different or left on there. It also cleans off a little bit of the residue from soap and stuff like that they use, because a lot of it you can't touch. So it comes out of there. Then it comes to what's called the clean side. Then it's in this little tray that's actually been in the whole time pretty much. Then we take it. This is what I've been doing. We take it, we sort it out. We get a count sheet. Let's say it's a minor set. It'll say minor set, 4 hemostats, 4 Kellys, 4 cryos, 4 peons, 4 towel clips, 4 this, 7 this, 6 that, whatever. It has a list, and you just go through and make sure everything is in that set. Everything that's supposed to be there is there. And if it's not, well, we want to know why. First off, because sometimes, it's still they're being cleaned, or, a lot of times what happens is, let's say they have 2 sets, and they just put it all together. Which is what commonly happens. So if they pull 2 trays for a single set, or for a single procedure, they're probably mixed together. So anyway, so then we put everything back in, sort everything out. We put these sterilizer indicators in the actual tray itself. Okay? Then we put, sign off that yes, everything was here, and we counted it. When we sealed that thing, and we put the lid on, and we seal it. We put sterilizer tape, or put a little card on there that has a sterilizer. Okay? Then we send it to the sterilizer. Then it goes over to the other side. Okay? The other side is where it's stored until somebody needs it. So that's what I've been doing. Another week of that before I go to the OR. Okay, so that's how my externship's going so far. It's actually interesting. And the reason they want you to do this is because they want you to know your instrumentation. If you can't tell the difference between, a cryo and, let's say, a sponge stick, then you're not going to do any good when the surgeon asks you for something. So, oh, I forgot to say what this thing was. And I think I think the label for this thing just went down to the cracks in the guard. So far, not bad. So far. Alright, that's it.